Hello. So to first begin our range of motion exercises, it's important to walk into the patient's room, knock on the door, introduce yourself, and let the patient know everything that you were about to do. You don't want to go in and not let them know what's going on because then they might be afraid of what might happen. So the first thing you want to do is your patient would normally be laying on the bed, so I'm going to go ahead and lay down on my bed. So the first exercise that we are going to do is shoulder flexion and shoulder extension. You want to have your patients lay flat on the bed, palms down. So what you're going to do is you're going to have them raise their arm up, shoulder flexion, and shoulder extension. Shoulder flexion, shoulder extension. Shoulder flexion, shoulder extension. Now you can do this on both sides. It's important to look at the physician's order and make sure that they say either left or right or bilaterally. So the next exercise that we are going to do is shoulder abduction and adduction. So what you're going to do is same thing, palms down, and you're going to go out, come back. Shoulder abduction, shoulder adduction, shoulder abduction, shoulder adduction, shoulder abduction, shoulder adduction. Again, this can be performed on both sides or it can be performed on one side depending on what the physician orders. The next thing we are going to do is elbow flexion and extension. So you still want their arms to be by their sides. You're going to gently raise their forearm up. So this would be shoulder flex or elbow flexion, elbow extension, shoulder flexion, elbow flexion, elbow extension, elbow flexion, elbow extension. Elbow flexion, elbow extension. Next, you would normally do the knee and the hip. Today we're only going to do the knee. So what you're going to do is you're going to have your patient pick up their leg and bend. You would normally help guide them. So what you're going to do, knee flexion is pulling in, knee extension is straight, knee flexion, pulling in, knee extension, pulling out, knee extension, knee flexion, knee extension, knee flexion, knee extension, knee flexion. Again, you can perform on both sides depending on physician orders. Next, we're going to do your ankle. So you would help guide the patient's leg straight up. So you're going to pull up towards you. That would be ankle flexion, or also known as dorsiflexion. And then pushing down onto the gas pedal, plantar flexion or ankle extension. Ankle flexion, pull it up. Ankle extension, pushing down. Ankle flexion, pulling up, pushing down, ankle extension. These are your typical range of motion exercises. You can also, make sure whenever you leave the room, you want to, make sure that the patient doesn't need anything, make sure the call bell is in reach, make sure that they have water if they're allowed to have it, ask them if there's anything that they need. And give them the opportunity to ask any questions that they may have.